Assalamualaikum viewers. So today we will be discussing सबसे important testing and the most extensive testing PGT-M, जो कि embryo stage पे होता है, because this is a series of PGT testing. So this is another type of PGT testing, PGT-M. Full form is Preimplantation genetic testing, and the M stands for monogenic disorders, or monogenic in simple words. So this test basically आपके पास स्क्रीन करता है इन एम्ब्रियोज. जब हम आईवीएफ करते हैं, एम्ब्रियोज बनते हैं, तो एम्ब्रियोज के ऊपर एट डे 5 वी टेस्ट दैट आइदर स्पेसिफिक डिजीज जो है वो उस एम्ब्रियो में मौजूद है या नहीं है. आर दे फ्री फ्रॉम दैट स्पेसिफिक डिसऑर्डर और नॉट. सो आपके पास पहली बात तो आ जाती है कि सिंगल जीन डिसऑर्डर्स क्या हैं. There are roughly around 25,000 genes in human body. Currently, 9 to 10,000 genes are associated with different diseases. Common one जो हम सब ने सुने होते हैं daily routine, thalassemia is one of them. Muscular dystrophy is another one. Breast cancer का BRCA1, BRCA2, those are single gene disorders as well. उसके अलावा हीमोफीलिया आ जाता है. काफ़ी डिसऑर्डर्स है जो कि क्वाइट कॉमन है हमारे पॉपुलेशन में. एंड when a couple has a child affected by these disorders, that's उनके लिए काफ़ी problems होते हैं, both emotional as well and financial as well, to have a handicapped child या फिर constantly taking care of that child जो कि lifetime के लिए have this problem, because genetic conditions, majority of them, they don't have exact treatments just to cure that disease, but symptomatic treatments of them. So it is quite important to prevent this disorder in the next generation, because we are preventing the Mendelian disorders जो कि inherit होते हैं autosomal recessive में, autosomal dominant state में आपके पास inherit होते हैं. So once we find out कि एक specific couple है, they are inheriting a specific disorder, we will take an example of thalassemia, beta thalassemia or alpha thalassemia, anyone. So in case of beta thalassemia, if the couple is carrying that specific mutation in the HBB gene, both husband and wife में, consanguinity में हमेशा पूछते हैं when couple go to a gynecologist or any doctor, so वो पूछते हैं कि आपके cousin marriage है और नहीं है. It's because of this reason, because cousin marriage में the chances of having an affected child just increase. It's not necessary कि हमेशा cousin marriage में disorders हो. It's out of family जो है वो disorders ना हो. Out of family भी there are risk as well. And but in cousin is just आपके पास increase हो जाते हैं the chances. But for such couples, it's they can still have a normal children as well. They can have it, and but they can opt for the preventive procedure like PGT-M. So in PGT-M, they initially do the probe development, possible recombination of the genotype and the different haplotypes. We will discuss that in other videos as well. And so they develop the probes, and through those probes they test the embryos that the embryos are carrying that specific disorder or the mutations or not. And so that's why PGT-M is used to prevent single gene disorders. आपके पास कोई भी single gene disorder हो, either it's oncology or cancer related, like breast cancer or family में run कर रहा होता है breast cancer, and the couple, if a female is affected and she want to have a child and free from that कि उनको future में वो disease ना हो because of the inheritance spectrum, अगर genetic factors involved है, so they can opt for that specific preventive procedure and they can prevent this in their next generation. And other disease like Huntington disease आपके पास आ जाता है, the same like muscular dystrophy, spinal muscular atrophy, multiple brain developmental आ जाते हैं, cerebral palsy के few types आ जाते हैं. If the mutation is known, आपके पास known है कि this specific mutation and the husband and wife both are carrying that specific mutation, so that can be prevented through PGT-M. And that's why PGT-M is quite important. And in recent published data in Pakistan, the consanguinity, which we call cousin marriage as well, it's roughly around 60%. So आपके पास the chances in the next generation of our population and next generation in our population is quite at risk of having certain specific disorders as well. So आपके पास it's not आपके पास कि वो शादी ही ना करे if a person is carrying that disorder, और या फिर वो बच्चे पैदा ना करें. They have the right to reproduce as well, and they can opt for the preventive procedure and can have a normal child. And आपके पास additional there is an specific type of PGT-M का variant होता है which we call PGT-M HLA-match. ये specific cases में होता है in diseases like thalassemia. If a patient has a thalassemia major child and they want to have a normal child with the HLA matched with the elder brother or sister, so they can opt for that because of for the treatment procedure and the surgical procedure. So they can opt for it and can go for PGT-M HLA match as well. Thank you viewers for watching our video. You can like and subscribe to our channel.